Okay, let's dive right into an explainer on a massive medical headline that's been making waves recently. It's a breakthrough that touches on something deeply personal for millions of families around the world, and honestly, it completely shifts how we think about the timeline of cognitive decline.
So would you want to know? It is one of the most profound medical questions you could possibly ask yourself. I mean, for decades, this was pure science fiction, right? You literally couldn't know until the memory issues actually began. But, well, this isn't a hypothetical anymore. A recent study suggests a new blood test might give healthy adults exactly that foresight. Let's look at how.
Section 1. A 10-year warning.
Let's start by unpacking what the researchers actually found and, why it's making headlines worldwide. It's really important to understand the scale of what we're dealing with here. Researchers recently published findings in the prestigious journal JAMA, and they showed that apparently healthy people, like people with absolutely zero current memory issues, might be able to see their cognitive future up to a decade before any symptoms begin. A 10-year early warning system, right, from a simple blood draw? It's incredible.
Section 2. The biological tipping point.
To grasp how this kind of prediction is even possible, we need to look at the underlying science and what experts are calling the biological tipping point of the brain. To do that, we got to look at the specific biomarker they're testing. It's called p-tau217. While the exact root cause of Alzheimer's isn't perfectly understood just yet, its telltale signs are brain-clogging amyloid plaques and neuron-killing tau tangles. This p-tau217 blood test measures a form of tau that perfectly correlates with how much plaque buildup someone has. So it gives us this really critical hint about those destructive tangles forming in the brain.
And here's why that matters so much. The leading theory among scientists right now is that Alzheimer's isn't a sudden event at all. It's a super gradual process. It's kind of like a domino effect. First, amyloid plaques silently build up in the brain. Then, at some critical tipping point, this buildup eventually acts as a trigger for an abnormal type of tau to form those tangles. And only after that whole cascade do cognitive symptoms finally begin to show up.
Dr. Risa Sperling, the study's senior author from the Mass General Brigham Neuroscience Institute, points out that this blood test isn't just a simple yes or no. Instead, you can think of it kind of like a gauge telling you exactly where you stand in that biological timeline. It literally measures how far along a person is in that silent, hidden progression way before the symptoms ever surface.
Section 3. The risk by the numbers.
Okay, so how reliable is this gauge really? When scientists say they can predict something a decade out, we obviously need to see the proof. And the Mass General Brigham team didn't just guess, and they didn't use a small sample size either. They analyzed a massive trove of data from 2,684 older adults. What's absolutely vital to note here is that these folks were completely healthy when they enrolled in long-running Alzheimer's studies. They got this p-tau217 blood test at enrollment and then were tracked with yearly cognitive checkups, some dating all the way back to 2004. And out of this massive group, about 478 eventually developed cognitive impairment.
Now, the crucial point is right here. When researchers look back at the initial blood tests of those who got sick, the correlation was just staggering. Symptom-free adults who harbored very high levels of p-tau217 had a 38% risk of developing cognitive impairment at 5 years. But look at what happens over a decade. That risk skyrocketed to a massive 78% by 10 years.
And the crazy thing is, the accuracy worked in both directions. On the flip side, the test also reliably identified those who had a very low risk. Study participants who had very low p-tau217 levels safely maintained a low risk of developing cognitive impairment over that exact same 5 to 10 year period.
Section 4. Why doctors say wait.
With numbers that strong, you're probably wondering, why can't I just call and ask my doctor for this test today? It sounds like a total no-brainer, right? But here is the crucial reality check from the medical community. Predicting the future is inherently messy. Scientists warn that predictions can be clouded, especially when you're looking over an entire decade. Older adults might develop memory issues from entirely unrelated things, say, vascular dementia caused by heart-related problems, rather than the amyloid and tau-driven Alzheimer's disease. Or they might just face other completely different life-threatening conditions. Life happens, basically.
Furthermore, as researchers Dr. Suzanne Schindler and Dr. David Wolk pointed out in JAMA, we really have to look at the study's limitations. Because only a small fraction of the study's participants were actually tracked for the full 10 years, that 10-year risk estimate isn't quite as confident as the 5-year one. The long-term prediction just isn't precise enough yet to guide an individualized prognosis.
But honestly, there's a deeper, more human reason doctors are hitting the brakes here. Knowing your fate without having a cure can be absolutely terrifying. It's a massive psychological burden. And this is exactly why Dr. Sperling firmly advises against rushing out to get this test right now, stating pretty clearly that we should wait until there's actually a medical intervention available.
Her point is basically that getting a high-risk result today wouldn't actually change her medical advice to you. Instead of agonizing over a future you can't medically change just yet, she recommends focusing on actionable, daily habits. Her advice right now remains exactly the same. Eat well, sleep well, exercise a lot, and stay mentally and socially engaged to protect your cognitive health.
Jessica Langbaum from the Banner Alzheimer's Institute totally agrees with this. She notes that while the findings of this study are quite strong and undeniably important, she's already seen people with family histories coming in and asking for the test, and she strongly discourages them from seeking it as a consumer diagnostic tool today.
Section 5. The real immediate benefit.
So, this brings us to a fascinating crossroads. If doctors are literally telling the general public not to take the test, why is this research being celebrated as such a monumental breakthrough in the fight against Alzheimer's? Well, because the true immediate value of this p-tau217 test isn't actually for our personal peace of mind, it's for science. Right now, large clinical trials are actively testing drugs that might prevent or delay Alzheimer's. To know if those drugs actually work, scientists need an easy, accurate way to identify and enroll the right high-risk people into these studies before their symptoms start. This blood test serves as a revolutionary accelerator for drug development.
And that leaves us with a truly incredible thought. This breakthrough brings us one giant step closer to actually finding a cure by massively speeding up the research process. It paves the way for a future where a simple blood draw at your annual physical could just be followed up with a preventative treatment. So, I'll leave you with this. If these clinical trials succeed, and knowing your status means you could actively prevent the disease, will you be ready to roll up your sleeve and take the test?